Today we are going to talk about the absolute #1 best meal to prevent heart attacks and a stroke. There is something very unique about heart attacks and strokes that is often misunderstood. 80 to 90% of heart attacks are caused by clots. Now, you might think, like this plaque that builds up is the primary issue. No, most of heart attacks come from clots. Furthermore, 87 to 91% of strokes also come from clots. The meal we are going to talk about today really has to do with preventing these clots. It is crucial to shift our focus to this clotting mechanism if we want to truly protect the cardiovascular system. If you are finding this information valuable so far, please take a moment to like this video and subscribe to the channel for more health insights. And this information today is based on the groundbreaking works from Professor Douglas Kell, who is truly a genius in this field. I will put a link down below referencing some of his vital information for you to explore. But what he stumbled upon is something very unique and absolutely fascinating relating to the concept of dormant microbes. It is crucial to understand exactly what is happening inside the body regarding these microscopic entities. You see, a lot of these dormant microbes are actually pathogenic. That means that under the right circumstances, they create disease. However, right now, they are not acting like typical active infections. Instead, they are asleep. They are existing in a state of suspension, and they are quietly waiting for an opportunity to come back alive. To give you a clear picture of how this biological process works, I want you to look at nature. Think about what happens during the winter season. When the ground freezes, you have all these microbes living in the soil. Now, these microbes do not die off when the temperature drops. Instead, they become frozen. They are going into this specific dormant mode, or what we might call a spore mode. In this state, they are completely inactive, protected from the elements, and they are simply biding their time. They are waiting until the season begins to change. They are waiting for that precise moment when the conditions shift, allowing them to come out of their hibernation and thrive once again. This is exactly what is happening with the pathogenic microbes inside the human body. They are asleep, hidden, and waiting for the internal environment to change so they can wake up and cause the problems we are trying to prevent. So, this is what you need to know regarding the mechanics of how our blood works. To understand the danger, we first have to look at the process of how a clot forms normally. Normally, when a clot forms, whether you cut yourself on your finger or perhaps something happens internally, your body reacts instantly. You have certain things that come in there to address the injury. You have certain proteins that are dispatched to the area to form a clot and stop the bleeding. And then, right after that, once the injury heals, the clot naturally dissolves. This dissolution process varies in time. Sometimes it happens within minutes. Sometimes it happens within hours. Sometimes it takes a little bit longer. But the key is that it does go away. This is a normal clotting process. It is absolutely vital to understand that this is a critical survival mechanism. If we did not have this survival mechanism working exactly this way, we would bleed to death from minor injuries. However, in certain circumstances, especially when we are looking at heart attacks and strokes, we have a completely different type of clotting that occurs. This is where the situation changes drastically. Now, we are not seeing a soft, temporary patch. Instead, we have dense, matted strings of spaghetti that get hardened. These structures become solidified, and they are very difficult to dissolve. What you need to know is when we are dealing with most heart attacks and most strokes, we are not talking about a normal clot. We are talking about a different type of clotting entirely. We are witnessing a situation where this normal, healthy clotting process changes over into something that is very dysfunctional and persistent. Now we must address the most critical question in this entire process. What causes this normal clotting process to turn over into this dysfunctional clotting process? We need to understand exactly what triggers this dangerous change. The first thing in what we call the perfect storm is a leak. This is not just happening anywhere. It is happening in very specific barriers in your body. It is a leak from either in your gums, in your mouth, or it is a leak in your gut. These are the entry points. Now, let us look at what is actually entering through these leaks. If you have a certain type of pathogen, a specific biological event occurs. This pathogen breaks down part of its outer shell, okay? Or as they call it, the outer wall. When this breakdown occurs, the substance that is left is called an endotoxin. Okay, endotoxin. This is the key player in this perfect storm. You might assume that you need a massive infection for this to be a problem, but that is not the case. And all it takes is the tiniest amount. Just the absolute tiniest amount of this endotoxin from this pathogen is sufficient. It is enough to cause this conversion from a normal clot to an abnormal clot. We can actually see the evidence of this in medical imaging. Even when they do an evaluation with calcium in your arteries, they see this happening. They might find soft plaquing, and inside that plaquing, they find many times this endotoxin. It is embedded right there in the artery, which again, it is just a little tiny piece of a pathogen, but it is responsible for turning a survival mechanism into a major health risk. We also have a major factor in this equation that we must discuss, and that is the problem of excessive iron. What you need to know about iron is that your body is actually very intelligent when it comes to this mineral. Your body has all these specific mechanisms to tightly control iron levels. The body does this for a very specific reason. It controls the iron because if there is too much iron floating around, your pathogens will just thrive like crazy. You have to understand the biological difference here. Whereas we, as human beings, need oxygen to live and function, these microbes are different. Pathogens live on iron, and so, inside your body right now, there is this constant battle taking place. It is a battle between the good bacteria and the bad bacteria, and they are fighting for iron. This struggle becomes dangerous when the balance tips. If there is too much free iron available in the system, that excess can feed this endotoxin we discussed earlier and amplify it. In fact, that free iron can actually wake up these dormant microbes that are sleeping in your tissues and create more clotting. And this is exactly why people that have certain genetic problems that result in too much iron are at a much higher risk for heart attacks and strokes and inflammation. Because of this risk, you need to be very cautious about taking too much iron. This is especially true as you age, because as you get older, you are more at risk for this problem, and it is especially critical if you have endotoxins present in your body. So, we have to ask the question, where does this extra, dangerous iron come from? Well, a lot of times it comes from sources you might not suspect. It comes from fortified foods. When you go to the grocery store, you will see that they fortify cereal, bread, and pasta with this iron. This is a very common source of the excess. Now, it is important to make a distinction here. You also have iron from your food like in red meats. That is a different story. That is the iron that our body can really use to go into the blood cell and into our muscle tissue that is beneficial. However, we must look at the iron coming from the supplements that people take. I would never recommend someone taking a supplement with iron, even if they are anemic. It is just not the right approach. Instead of a synthetic supplement, I would probably have them take a heme type of iron. This would come from natural sources, either from red meat or from liver, something like that. You want the natural form, but not the type of iron that is found in most of the supplements on the market, especially the popular one-a-day vitamins. There are other hidden sources of iron as well. I also do not recommend that you cook in iron skillets. Using this cookware can leach extra iron into your food. As a final side note, you must consider your habits. When you drink alcohol, that also increases more iron in our bodies. So, you have to be careful with that as well if you want to prevent this clotting mechanism. Now, let us talk about the stress. When you go through stress, you increase adrenaline. Adrenaline takes this to the next level. This will really supercharge or 10 times the amplification of these pathogens in relationship to being able to consume more iron. Because if you think about it, adrenaline is a stress, and stress shuts down your own immune system and allows these microbes to actually be out of balance and start to grow more. And this is why even if you take a steroid, which is kind of a synthetic version of cortisol, which is another stress hormone, that can really take your immune system and just completely turn it off. This is why when someone goes through stress, the risk of dying from a heart attack goes up, sometimes up to 2000%, especially after severe stress or grief from the loss of a loved one. Now, I do want to mention a couple other things about this leaky gum and leaky gut situation. We need to know what causes this leak in the first place. Now, with your gut, it could be gluten. That is the protein that we cannot really digest too well in certain grains. Alcohol, smoking. Seed oils are very corrosive, and they create like a rusting effect on our tissues. Ultra-processed foods, refined sugars, refined starches actually feed these microbes, especially the pathogens, NSAIDs. That is for pain that can actually destroy the lining of the tissues, and especially antibiotics. Now, let us talk about the perfect anti-clotting meal to prevent all of this. You know, when you think about it, most people think if we are talking about a meal to prevent a heart attack or a stroke, they are immediately going to think, oh, we have to go low cholesterol, we need to consume less saturated fats, right? That is definitely not what I recommend, and that is based on some past outdated information that is completely untrue. So, now let us get into the perfect anti-clotting meal. The first thing I am going to talk about is the protein for this meal. We want a protein that does not have necessarily excessive amounts of iron, and out of all the protein that would be the best for that, it would be the wild-caught salmon. Now, you can do other fatty fish, but wild-caught salmon is one of the proteins with lower iron, but it is also the highest in omega-3 fatty acids, which is really good for preventing clotting because it thins the blood. It reduces inflammation in the arteries. And salmon does have some iron, but it definitely does not compare to red meat. So, let us pair this salmon with a very specific type of salad that involves arugula. Arugula is very unique because it has the most nitric oxide. Now, I did not talk about nitric oxide in the first section of this video, but I want to let you know that nitric oxide is a super powerful anti-clotting compound, and this will also help if you have high blood pressure. And the second thing that has the most nitric oxide is beets. So, if we add the beet to the arugula, we have a very powerful anti-clotting salad. Now, let us not stop there. Let us add some extra virgin olive oil, which has really key polyphenols, which bind with iron and help to lower iron. Not to mention, polyphenols are very anti-inflammatory. And plus, extra virgin olive oil will help to decrease blood pressure if you have it. Then if we add some apple cider vinegar to that, we can tighten any type of leakiness in our tissues, especially if it is in the colon. So apple cider vinegar can help do that. Now, if we add some garlic to that salad or maybe even put it over the salmon, now we are really in business of supporting the cardiovascular system because we are going to thin the blood. We are going to add polyphenols to also bind with that extra iron if you have any. And garlic also is a powerful anti-pathogenic remedy. So that will help with any microbes that are in your body that should not be there. If we add a little sauerkraut, just a little bit, maybe like 1/4 of a cup, then we are going to add lactic acid bacteria, which actually binds with these endotoxins and helps neutralize them. Now, there are other ways to get lactic acid. You can do a little kombucha tea. You can add the juice from pickles, for example. So, sauerkraut is not the only way to get lactic acid. But let us not stop there. Let us add some more polyphenols to bind with the excess iron, because the free iron is really at the core of this clotting problem. So if we added either green tea or black tea, we can bind up some of that iron. If we also add a little dark chocolate at the end. Now, you can either get the 85% or 90% dark chocolate and add that to the meal just a little bit, which can actually bind this iron because it is loaded with polyphenols. But also, dark chocolate is loaded with magnesium, which will also help the arteries and the heart, because heart problems are really related to too much calcium and not enough magnesium. Magnesium is one of the best things for atrial fibrillation and also to help lower blood pressure. You can even take this dark chocolate powder and put it in your coffee in the morning. That is what I do. Just a little bit, dissolve it up, and drink that down for the polyphenols after you have eaten the meal. Okay, go for a 10-minute or a 20-minute post-meal walk while you breathe through your nose. Nasal breathing increases nitric oxide and actually enhances the oxygen, and exercise itself can help dissolve clots, not to mention help your blood sugars be balanced better, not to mention increase more oxygen into the body. And so the combination of this meal with this exercise is going to greatly reduce your risk of both heart attacks and strokes. If you found this video helpful, please don't forget to like and subscribe to stay updated with more health tips.